Good morning, everyone. I'm just going to give another 30 seconds for more attendees to filter in to the webinar. Thank you so much for joining us this morning. Hey, good morning, everyone, and thank you so much for joining us for today's Spring Update to Families webinar featuring guest speakers from the Ontario Ministry of Long-Term Care. My name is Tiffany Fearon, my pronouns are she, her, and I'm the Policy and Research Manager at Family Councils of Ontario. It's my pleasure to assist with hosting today's session. Before we start, I'd like to take a moment to recognize the land on which we are gathered here today. We are meeting on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabeg, the Chippewa, and the Haudenosaunee and Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. As a remote team, we encourage our team members, service users, and partners to reflect on colonialism's enduring legacy and engage in reconciliation meaningfully. We encourage everyone to visit whosland.ca to learn more about the territory your home is situated on. The work that non-Indigenous organizations and individuals need to do towards reconciliation with Indigenous peoples is a long-term journey, specific to each individual, and is constantly evolving for our organization. We hope that you will join us in this journey. You'll notice that all participants are in listen-only mode, so you can hear us, but we can't hear or see you. There'll be interactive component during the presentation, during which our events coordinator will activate the feature for you to turn on your mic, and we invite you to participate. Throughout the webinar, please use the question and answer feature to submit your question. We'll answer as many as possible within the time allotted at the end. If you have any technical issues during the webinar, please feel free to put it on the chat or message our events coordinator directly. Today's session will also be recorded and made available to participants following our time together on the Family Councils of Ontario website and YouTube channel. Now, without further ado, it is my great pleasure to introduce the first speaker, Laurie Coleman, Director of the Response Branch. Over to you, Laurie.
Thanks very much, Tiffany. Good morning, everyone. It's very nice to be here. And I really want to thank everybody for taking the time to join us for this ministry update. I know how busy, in particular, all of you are as families and caregivers to residents living in long-term care. You're balancing that with work commitments, with other family commitments, with commitments that come along with spring, like gardening and activities. So our thanks to you for joining today. Again, my name is Laurie Coleman. I work in the policy division at the Ministry of Long-Term Care, and I'm really pleased to be joined today by other colleagues from across the ministry to provide some updates for families and caregivers with regards to a few different things. So today we're looking forward to talking about the spring 2024 COVID-19 vaccine campaign, respiratory illness guidance, funding changes, and we're also going to take some time to talk to recent changes to the rules and regulations for long-term care homes in Ontario and how this will impact families, residents, caregivers right across the province. I really want to extend a thank you as well to everybody at Family Councils Ontario. So we've already heard from Tiffany this morning, and we know that we have other colleagues at Family Councils Ontario who work hard to facilitate times like these where the ministry can really engage with families and caregivers So my sincere thanks to Family Councils Ontario. We always look forward to hearing their perspective, and we very much want to hear your perspective today as well. So as Tiffany mentioned, we've saved time at the end of today's presentation to hear your questions with regards to the presentation. And again, you can type those into the Q&A feature, or when we get to the interactive portion, you can raise your hand electronically and we'll work to take you off of mute so that you can pose your question verbally to us. We'll do our very best to get through as many as we can. So with that, I'm going to hand it over to my colleague, Christine Luero, who's going to talk to us this morning about COVID-19 vaccinations and respiratory guidance.
Thank you so much, Lori. Good morning, everyone. I'm so pleased to be here with you this morning to give you some updates related to the vaccine, COVID vaccine, and some changes in respiratory illness guidance. As Lori said, my name is Christine Loureiro, and I'm a director in the operations division of the Ministry of Long-Term Care. I want to first start just by thanking all of you for supporting your loved ones in long-term care homes, all your efforts and commitment and sacrifices and doing your part to keep people safe throughout what has been a very challenging respiratory illness season. As in the ministry, we really want to try to balance the health and well-being of individuals living in long-term care, not only from a health and safety outbreak management perspective, but also overall psychosocial well-being of residents and family and staff. We have some time at the end of my portion for a bit of an interactive session where we look forward to getting some of your input and feedback on what we can do better for next respiratory season. So the first update from me is on the spring COVID vaccine campaign. Getting vaccinated and staying up to date with vaccines is really the best way to remain protected against severe illness due to COVID-19 and other respiratory illnesses. Because of the waning immunity from the vaccine over time, and the fact that COVID has not yet established a seasonality in the same way as flu. We know flu is generally higher over kind of the fall winter. COVID is circulating still year round. We do still see COVID outbreaks in long-term care homes even over the spring, summer, and we're uncertain about when that next wave could start. So it's always good for people at risk of severe illness and hospitalization to keep their vaccines up to date to protect them against severe illness. Next slide, please. So in Ontario, we will be running a spring COVID-19 vaccine campaign that is running from April to June, and it's really targeting those at highest risk of severe illness, including adults over the age of 65, residents living in long-term care homes and retirement homes, as well as those who are immunocompromised. Next slide, please. Receiving the COVID-19 vaccine this spring is particularly important for those, as I mentioned, who are at increased risk of severe illness, but for those who did not receive their dose during the fall-winter campaign, it is still recommended, though, for those who did receive it over the fall-winter due to that potential waning immunity from the vaccine. Individuals can receive their vaccine 6 months from their last vaccine dose or from their last COVID-19 vaccine and their last COVID-19 infection, or they can receive it as short as a period of 3 months with advice from their healthcare provider. Next slide, please. I will say we do anticipate a likely another fall COVID-19 vaccine campaign along with the annual flu vaccine and a continuation of the RSV vaccine campaign, which was just introduced this past fall. And details on those will be provided a little bit closer to fall as the government, prepares for those vaccine campaigns. There is a link here on the slide for your reference if there's any additional information you'd like to receive from me about the vaccine campaign, or feel free to speak to the long-term care home for additional information. Next slide, please. I also want to provide you with some updates on the ministry's COVID-specific guidance. So homes are, first and foremost, continue to be required to follow infection prevention and control, or how we acronym IPAC, requirements that are set out in our act, regulation, and in the IPAC standard for long-term care homes. That includes measures such as staff wearing a mask based on an individual point of care risk assessment, regularly screening residents for signs and symptoms of infection, practicing good hand hygiene, conducting regular IPAC audits to make sure the home is following required IPAC practices. So that will, oh no, go back to slide 8, thank you. So with these changes to enhance IPAC programs in long-term care homes, the ministry has decided to revoke the COVID-specific minister's directive and related guidance document, really in an effort to streamline and integrate the number of IPAC and outbreak management related requirements into fewer guidance documents while continuing to maintain those robust IPAC requirements. Next slide, please. Homes must also continue working with their local public health unit when they're in outbreak, and they're guided by a new Ministry of Health guidance document on outbreak prevention and control. This new guidance document merges a few different guidance documents that used to exist, bringing kind of everything together into one guidance document to really support public health units and helping homes and other congregate settings manage outbreaks. I am joined today by a colleague from the Office of the Chief Medical Officer of Health, Stephanie. If you could come online and provide us with an overview of some of those changes, that would be great. And Malika, you can move us to the next slide.
Thank you, Christine. Hi, everyone. Thank you so much for having me with you today. My name is Stephanie Georgopoulos, and I am a Senior Policy and Programs Advisor with the Infectious Diseases Unit in the Office of the Chief Medical Officer of Health at the Ministry of Health. Christine had mentioned that we have updated our guidance document. Most of the updating was merging 3 other documents into one. This document is mostly for public health units to assist them in managing outbreaks in congregate living settings, such as the long-term care homes and retirement homes. And it merges respiratory, gastroenteritis, and COVID-19 into one document, all of those different types of outbreaks. So what has changed in this document? Basically, we have added some, I guess, evolving updates to our COVID-19 guidance, but also wanted to refocus the direction to highlight the importance of the balance between resident mental health, caregiver support, and infection prevention and control. And so what are some of the things you can do to help keep your loved ones healthy? You can ensure that you stay home if you're feeling ill or you're feeling off. Ensure you clean your hands with alcohol-based hand rub or soap and warm water if your hands are visibly soiled when you enter the home, before you enter your loved one's room, and before and after helping your loved ones. So, for example, before providing food or care. Ensure you stay up to date with vaccinations, including COVID-19 and yearly influenza vaccines to prevent spreading an infection to loved ones. And ensure you follow any specific recommendations or requirements in the long-term care home regarding the infection prevention and control practices. So, for instance, the use of personal protective equipment such as masks, hand hygiene, etc., for essential caregivers. We just wanted to make sure that we were able to balance the needs of the resident and refocus back on the residents, caregivers, families, and the support that they provide to the residents. So I thank you so much for having me have the ability to present to you today. And I know there will be some question and answer periods later. So if you have any questions, you can follow up then. Thank you so much, Christine.
Thank you so much, Steph. We can move to the next slide, please. So while we've kind of just recently come out of the last respiratory illness season, the ministry is already working with colleagues such as Stephanie and folks at the Ministry of Health on thinking about next year's respiratory illness season and making sure homes are as prepared as possible and that we're supporting homes and residents and caregivers and family members as in the appropriate way for what we might be projecting for next respiratory season. So this is part of where we're hoping to get some of your feedback in terms of what worked well and what could be done differently. I will say before we jump into the interactive portion, what we did see over last respiratory illness season was a fairly challenging season. We did see more outbreaks in long-term care homes than we did the previous year. We saw the cumulative impact of COVID, flu, and RSV outbreaks. For example, there were over 1,000 COVID outbreaks over the period of that kind of fall, winter in long-term care homes. However, even with that high number of outbreaks, homes were able to manage it so fewer residents became sick and become infected with COVID. There were lower hospitalizations and the kind of lower risk of severe illness, in part to the vaccines, but also in how the outbreaks are managed. So I think that's some really promising trends that we saw over the respiratory illness season, even though we did see, a large number of outbreaks. And that is to be expected when viruses are circulating in the community. So I'll move to the next slide, please. So as I said, as part of this session today, we really want to hear from you as we start this planning for next respiratory season in terms of what did you think worked well from your perspective? What could be done differently to support the health, safety, and well-being of residents, families, and caregivers? Any other comments or questions you might have for us? It's all really helpful, and we really reflect on that as we're preparing for the next respiratory season. So with that, I would love to open it up to hear if there's any questions, comments, feedback for us to consider. And you can feel free to raise your hand. We're going to try to unmute people if possible, or you can use the Q&A feature. I will also say, as we're waiting for people to put up their hands, this is not your only opportunity to provide us with feedback. If you think of something after the webinar, there will be an email address noted on the slides, and you can send us an email, or you can work through Family Councils Ontario to provide feedback to the ministry. I see Sylvie has her hand up. Are we able to unmute Sylvie?
Good morning.
Good morning.
I was just curious if, again, because you did mention we have to work with the health units, for the regions. And apologies if you did mention this, but it's still 10 days isolation. And my mom, not to use specific cases, but it's not a personal thing there, but she's in a shared room. And a couple of weeks ago, her roommate had symptoms of something. They weren't quite sure, if it was COVID or something, another virus, but in her ward or in her on her floor, people come in and out of the rooms, and it's really hard to stop the traffic. And at one point, her roommate was actually lying in my mom's bed, just because they kind of tend to do that. So unfortunately for my mom, and she's in a wheelchair, so she was not allowed to go out of her room at all and wasn't able to get herself out of her room, but everyone else around her was able to do this kind of traffic. So I just wanted to note that, the rules are in place for a reason, absolutely. But when you're in a situation that you can't really control the traffic, it's really hard and isolating for those who are just recipients of something else, if that makes sense.
Yeah, thank you, Sylvie, for sharing your mom's experience. I can't speak to the specifics of the scenario. I certainly hope you were able to communicate with the long-term care home about some of your concerns and the situation and bring it to their attention in the event maybe they weren't aware. I will say, and maybe Stephanie, you can add to this, in general, the guidance, so that outbreak management guidance does have some recommendations on isolation periods for those who are infected with, for example, COVID-19, and for people who might be close contacts, such as roommates. And this is where I'll ask Stephanie to maybe add and confirm, but generally speaking, for those residents who are ill with COVID-19, there is a period of kind of at least 10 days, assuming their symptoms kind of subside during that time, where they can transmit and are infectious to others. So that's when the enhanced precautions are in place for that 10-day period. For people who are able to wear masks, the kind of guidance has been updated over time to allow them to leave their room, just reflecting the impact that isolation can have on people, as long as they're wearing their mask. For roommates who may have been in close contact, or they're in close contact by virtue of being a roommate, generally there's a period of 7 days where they're being monitored for symptoms, and this is what's kind of articulated in the guidance document. So maybe, I don't know, Steph, if you want to add to or just confirm as I rambled on for that part of the answer.
You're not rambling. And I think that this is, I found myself rambling yesterday as well. But I think what's important to note here too is that, yes, there is a 10-day period, but there is also, and we note this in our guidance document, that we recognize the impact it had on residents and on caregivers and on staff. These, in terms of isolation periods and things like that, that it can be really hard for residents. So what we have noted in our guidance, and our guidance is pointed towards public health units to use, is that, having a conversation with the long-term care home to determine, can this person who might have COVID-19 or has COVID-19, can they mask? What is their mental health scenario like? Is there a way, essentially what they're assessing is there a way we can safely have this person not have to necessarily be isolated for that time period? Or is there a way that we can have some interaction where, they'll be able to limit spread so that other people don't become ill as well? So I think that's the point that I wanted to bring, is that although every scenario is different, there are some basic guidelines that the long-term care home can discuss with the public health unit to better support the resident in their needs. So, it's not cut and dry, but there is room for discussion and room for risk assessing to see, how can we better support this resident in their needs while they're trying to self-isolate, and also understanding that, other people are coming in and out, and obviously we want to reduce that so that we reduce the risk of spread. So all of those factors kind of come into play.
Thank you for that, Stephanie. And I'll just add, I think another thing we've heard is that variation that can happen across public health units or across homes and sometimes it might be very much appropriate to the circumstances of that outbreak, but sometimes that can lead to confusion or lack of clarity or inequity perceived by residents and family members. So that's certainly something that came up in our resident webinar yesterday. So definitely something for us to think about in terms of education and awareness raising of the guidance, and making sure people are aware, homes, residents, and family members of kind of what that general guidance is. Okay, don't think there's any other hands up. I do see a comment in the Q&A about the level of communication being appropriate and appreciated. So thank you. That's certainly something that we endeavor to kind of improve on from past practices, and are committed to kind of that ongoing communication. Oh, I see a new hand up, Doreen. Get Doreen off mute. Doreen, are you able to unmute? Oh, there we go. I see you're unmuted.
Yep.
Go ahead.
Thank you very much. I'm a chair of a family council in a long-term care home in Ottawa. And you may have partially answered my question with the previous question. Families have been noticing that there's been a great influx and change of staff over the past months. I mean, I know staffing is a challenge, and when people don't show up for their shifts or aren't able to come in, then they're shuffling staff around the home to meet the needs of the residents. But you may have already mentioned a site where we could find the guidance document. I'm particularly interested in the guidance document for staff.
Thanks, Doreen, for your question. Can I ask are you looking for the guidance document specific to handling outbreaks, or infection prevention and control more generally?
Well, I just don't know what's out there in
Yeah.
terms of guidance documents and families. So you've talked about guidance for families visiting, and you've talked about kind of how to isolate or accommodate people who are at risk of getting a COVID or a respiratory illness. So yeah, where are I guess just to change the question, where can we get copies of the guidance documents? If it's 1 or 2 or 3, 4.
So in this slide deck, which will be circulated after the meeting, there is a link to this new merged outbreak management guidance document that kind of goes through what is some best practice around isolation, case and contact management, etc. So there is a link there. Another document you might want to look at is the infection prevention and control standard, which sets out the requirements that all homes must follow to not only when you're in outbreak, but what you do to prevent transmission and spread of infectious illnesses. So what we can do is we can share that document also. It's not available on the public website in the same way because it's more of a home guidance document, but maybe that's one we could share with FCO to share.
Thank you very much.
Okay, I see Joanne has her hand up. Maybe we can take this last question or comment from Joanne. Go ahead, Joanne.
Actually, just a comment to the family council chair that just spoke. I was just wondering if her home had either offered to have the IPAC manager meet with their family council and or provide the family council with their IPAC policies so that they're aware of how things are structured in the home and what the expectations are. Because like she said, she doesn't know if there's 1, 2, 3, 4 documents. People don't know what they don't know. So, to have some guidance from the home and perhaps have the IPAC manager meet with them to outline the policies and the expectations would be, I don't know what their relationship is like with their home, but that's what's happened in our home. We're well advised about what the expectations are and the policies.
That's an excellent suggestion. Thank you, Joanne. I hope Doreen caught that.
Thank you. That we have a really good relationship, so I don't expect any problems.
That's fantastic to hear.
Awesome. That's great. Okay, I think that's it for me. I will turn it over to my colleague Suja to go over some of the funding changes. Thanks, everyone.
All right. Can everyone hear me okay? No echoes, hopefully. Hi, everyone. My name is Suja Sinterlinkum, and I'm a manager with the Funding and Programs Branch of the Ministry of Long-Term Care, and I'm going to highlight 2 key operating funding changes. Great, slide's already changed. So the first slide here talks to the increase in the operating level of care funding. So the level of care funding is the primary operating funding provided to long-term care homes. And this year, the government has provided a 6.6% increase, or 353 million more in operating funding, which includes an 8% increase in funding for the resident food envelope. This is cumulatively the highest operating funding increase in recent history. And with this funding, homes will be able to continue to provide nursing and personal care services, programs and activities, housekeeping, laundry, and meals for residents. Next slide, please. So the second slide here talks to the one-time operating funding of 202 million that has been provided already to all eligible homes in the earlier part of this calendar year. And this funding was to help address key sector priorities such as outstanding code compliance pieces, deferred maintenance, and all of which will hopefully improve the quality and safety of accommodations for residents. So those are two of the key operating funding highlights we wanted to bring to your attention. And with that, I can open the floor for any questions you may have. Don't see anyone, so that's okay. Oh, there's a
Yes,
hand
I
up.
have a question.
Yes.
Sorry. It's interesting. I listened to the French presentation on Tuesday,
Mhm.
and I thought that that the funding was not to be used for the actual structure. And so I must have misheard and misread, but I thought they were very clear that it was not to be used, that it was to be used for food or for or better food and other things, but directly for the resident.
Right. So there's two funding that we mentioned here. The first is the level of care funding, and that includes the nutritional support envelope, which is for specifically for food. So there's very specific envelopes in the level of care funding, and those are for the operation of the home. The second funding that we're talking about, the one-time funding, that was provided to help homes with key sector priorities, which could include deferred maintenance, pieces, as well as sprinklering and any other code compliance pieces. So that one talks a little bit more about the structural and can be used for some structural pieces. But the former piece that we mentioned, the level of care, is strictly for operating, and the nutritional support envelope would be specifically for food. Yes. I hope that helped clarify. It's two different.
Yes, thank you so much. That's
No
great.
worries. Any other questions?
Yes, I have one. Does this include for air conditioning in the home?
So I don't know if my colleague Erin is here, but this is, I know that air conditioning received separate funding previously, and that homes were required to be air conditioned. But if there's any outstanding pieces that the home would like to support through the one-time funding, it would be eligible if there are any outstanding pieces. Erin, did you have anything you wanted to add to that piece?
Well, this is quite important because there's some homes that it's difficult to get the air conditioning installed. It's Eleanor Ryan from Ottawa.
Yep, and I think I saw Erin unmute.
Hey, Suja, I was just going to mention that probably Nadine or Sean, if they're on the line, might be able to speak to that a bit better.
Oh, yes. Thanks, Aaron. Thanks, Suja. Yes, over the years, homes have had all the homes except for two, I believe, are deemed compliant with air conditioning. So they've been all received funding for air conditioning in resident rooms. We do know that some homes where it's a bit more complicated because they're a bit older, have dated infrastructure. So those projects cost a bit more money. But we do have a regulation in place where air conditioning is required in all resident rooms unless the resident doesn't wish to have the air conditioning installed. So it is a requirement that each room has air conditioning, and that's been a big priority for the government and the ministry over the last few years. And then really the only cases where air conditioning is not installed in a resident room is if the resident chooses not to have it installed.
Follow up to this question, does that mean that if the person doesn't want it, it can be taken are disconnected somehow in each room? And what happens when there's shared rooms?
That's right. So there's different kinds of air conditioning units. Some are like built into the duct system. If the resident doesn't want the air conditioning turned on in that room, it won't be turned on. In cases where there's a portable unit in a resident room, if the resident doesn't wish to have the portable unit there, the home is to remove the unit. And if the resident were to change their mind, the home needs to have that unit on hand in the facility so that it's ready to go back to the resident. In cases where there's a roommate or a shared room, I should say, the air conditioning needs to be installed unless everyone in the room agrees that it should be removed. So if one resident in the room wishes for it to remain, it needs to remain because that's the requirement that air conditioning needs to be installed. But it is our hope that the homes would help better match the shared room residents to ensure that they're both comfortable with the temperature in the room.
Well, thank you very much.
Thank you.
Okay, I think we have our next question from Sylvie.
Nope, apologies, I just didn't lower my hand, thanks.
Okay, and then I think there was someone else that had their hand up. Joanne? Yes.
Joanne, I have my hand up. I just, as a point of clarification for the gentleman that was just speaking about the portable air conditioners. So our home is an older home, so we don't have the infrastructure to have everything built in and whatnot. So there's portable units in everybody's room. Now, our understanding was that the unit has to be in the room. It doesn't have to be connected if the resident doesn't want it connected, but it has to stay in the room. And the rooms are small and it's cumbersome and in the way. So from what I'm understanding from him, they don't have to be in the room. They just have to be available.
That's correct. So the regulation's been updated over the years. So initially, your home would have been correct that the unit still needed to be in the room to meet the regulation. It just wouldn't have to be turned on. We realized that was we've heard from residents and homes that it does, when it's a portable unit, it takes up kind of unnecessary space if you're not using it, of course. So during the winter season when it's not being used, or if it's in the summer and the resident isn't using it, the home can put it away in storage. It doesn't have to be sitting in the room unused, because we know that if it takes away view or space in the room, or if it's in the window, it blocks view for that. It is required, though, that if the home were to be taking out a portable unit, it needs to be documented in the care plan for the resident that they're giving consent that the portable unit's not being used, it's being removed. And if the resident, let's say there's a really warm day and the resident chooses to change their mind, that the unit is on hand so that it can be quickly reinstalled into the room.
Okay, so you would need approval from both residents if it's a shared room, documented in the care plan. And when did this rule change from it that it had to be in the room to that it no longer needs to be in the room but be available? When did that change?
I believe that was in last summer's regulation. We do have some slides upcoming where there's even additional clarification on that. But I believe that last piece was from last summer.
So I guess like what's happened at our home is that initially families were told, like when they complained because their loved one didn't want it in the room or whatever, and complained, and they were told that it had to be in there in accordance with the ministry and and whatnot. I don't know if either the home doesn't realize that changed or certain staff members don't realize that changed, but we didn't realize it changed. It wasn't communicated to us. So that's great information for me, because I can now let the family members know that have been complaining at our home that they don't want that in there, that it can be taken out.
Yes,
Perfect.
for sure.
Thank you.
No, thank you.
No.
I think we had a question from Doreen. Doreen, did you have a question?
No, my hand was up from the last time.
Okay.
I should have been down.
No worries. So I think I'll just hand it back to Lori now. I don't see any other hands up.
All right. Thanks very much, Suja. So we're going to shift gears. The conversation on air conditioning was really timely because one of the things that we are going to touch on is changes to rules around air conditioning. So we can, thank you. We've moved to the next slide here. So on April 26th, the ministry had changes to the rules that long-term care homes need to follow. We had some changes approved. And those regulation changes include requirements in a few different key areas. So we've already talked a little bit about air conditioning, and I'll touch on that. But there were also changes with regards to qualification requirements for some of the staffing positions in long-term care, pandemic provisions, as well as replacement homes. And so why the ministry, for those of you who may be aware, the Fixing Long-Term Care Act is the founding sort of rule provision for long-term care homes in Ontario. And it was established a couple of years ago. And since then, we have made some modest changes to that legislative framework over the course of the past couple of years. The ministry is continuing to refine that legislative framework because we're working to ensure that long-term care residents are continuously receiving the best possible care and quality of life. And so that for us has meant making sort of iterative and modest changes to the regulation as we move forward. And we make those changes based a lot on what we hear from residents, from families and caregivers, as well as homes themselves. And when we do get to that air conditioning place, that's it was feedback that we got from people just like yourselves on how to make the rules more clear under the Act and regulation.
I hate to interrupt you, but
oh yeah,
in case we lose this screen, I do. It's Eleanor Ryan in Ottawa. I have a very if you can't answer, it's fine.
Okay.
It says here, the Ontario Association of Residents Council helped the ministry to connect with resident representatives. And as we know, the Association of Residents Council has residents involved, and it's a very good, I feel, association. Whereas the Family Council of Ontario helped the ministry to connect. My question is, where and how was family members involved, direct caregivers, the people at the front line, the family members in the long-term care homes? I know it's probably a question for the Family Councils Ontario, but how do they have family members really involved and connected when you are doing this involved with the new rules? If you can't answer it now, please, could it be taken note by FCO and yourself? Thank you.
Of course, I really appreciate that comment, Eleanor. And I don't know, Tiffany, at the end of this presentation, if that's something that you might be able to speak to. And if not, Eleanor, it's something that we can certainly take away and come back to you with an answer.
Very good. Thank you. That's great. Thank you.
All right. Okay, so we'll move on to the next slide. So I wanted to talk first about the changes that relate to staffing qualifications. And it was interesting, Doreen, you asked a question earlier about staffing, where you spoke about there being sort of a significant turn in staff in the home that you're connected with. And over the past few years, the ministry has continued to hear from homes, residents, families like yourselves, caregivers, about the need to find ways to ensure that homes have got the staffing teams necessary to support residents in their quality of care and quality of life. And so our examination of the rules right now, we're looking very closely at what barriers there might be in those rules that make it hard for homes to retain staff. And we've made some changes to provide more flexibility for homes to hire and retain qualified candidates. So as of May 1st, homes, this is already in place under the rule structure that we have. but we've extended it for a little longer. So homes are going to continue to have flexibility until July 1st of 2025, so next summer, to hire a person to provide personal support services as long as they have the skills, training, and knowledge to perform the tasks of a personal support worker, even if they don't have the full certificate of a personal support worker. So that's that flexibility is extended for another year for the very reason of ensuring that we have staff who have the skills, training, and knowledge working in homes and available to support residents. On the next slide, there are also changes with regards to regulated and registered health professionals from other health professions that would be able to perform skin assessments under certain circumstances. Right, the way the rules were written previously, skin assessments could only be done by a member of the nursing staff. But the changes that have come into place, they allow a regulated health profession, a different regulated health professional to do a skin assessment, provided that it's in their scope of practice through their regulatory college. So an example of that might be a resident who has a skin condition. That skin assessment for them may be best assessed by a dietitian. And dietitians are allowed within the rules for their health practice, they're permitted to do a skin assessment. So this is served to remove the barriers that are associated with limiting skin assessments. It's also allowed nursing student externs who meet certain requirements under the rules to perform those skin assessments as well. And again, this is giving homes more flexibility. And with regards to the nursing students, it's helping them on their learning journey so that they're able to become full practicing nurses. On the next slide, there are a few changes that won't take effect until the 1st of July. And the first of those connects back into nursing student externs who are working in homes. Those individuals will be authorized to administer drugs to residents, but there are some important conditions with that. So that can only be done under the supervision of a member of the registered nursing staff. And in cases where a home has determined that that individual nursing student has the required skills, knowledge, and experience. Another piece that's changed with regards to who can do what, registered practical nurses are going to be able to complete one of the assessments that's used to determine long-term care eligibility. And this change is really to support better resident care because it will allow registered practical nurses to work within that full scope of practice. And that should free up registered nursing time to focus on higher level clinical tasks. We've got a few more that I'll speak about before I pause for questions. So this connects back into some of the dialogue we had earlier that relates into outbreaks in homes. And the changes to the rules remove some of those specifications around pandemic that we currently have in our legislation. Those changes include ensuring that eligibility assessments for individuals who are coming into long-term care from the community, that those assessments are done with the most up-to-date and accurate information that's available for that applicant's care needs. There is also a change to ensure that the pandemic is not used as a reason for discharge from a home. And for context for these changes, the legislation and the regulation, they were written and they came into force right when we were in the midst of the pandemic. So we had pandemic references quite frequently throughout the Act and regulation. What we're doing here now is looking to modify so that we've got a more steady state going forward that's broader reference to things related to emergencies. On the next slide, and still in the space of pandemic recovery and stabilization, The regulation changes include removing exceptions that were giving homes flexibility for 24-hour nursing, the director of nursing and personal care, as well as staff orientation requirements, and ensuring that residents have and continue to have access to visitors during emergencies. So broader than the pandemic, but during emergencies. We'll move on to, and there's only a few more slides to go before we pause for questions. And Eleanor, I know you had questions about air conditioning, and we certainly know how important it is to supporting resident safety, well-being, and just enjoyment, and particularly timely given that we're coming into the summer months. So we've been taking feedback over the past couple of years about what might be confusing in our rules regarding air conditioning. And we've looked to clarify the language within the regulations. So as of May 1st, residents have more choice for air conditioning preferences. So we were working to clarify when homes would not be required to install a portable or window air conditioning unit if it's requested by residents. The regulation changes also make it clear that when room temperatures are over 26 degrees Celsius and when the room doesn't have air conditioning, that for the remainder of the day and the following day, homes have to implement a heat-related illness and management plan. We'll move to the next slide, and I think this is my last one on updates. So there were some very technical changes with regards to replacement homes. So as of July 1st, when residents are being transferred from their existing home to a replacement, a related, or a reopened home, the changes should support more streamlined movement with the admissions requirements. So currently, if a resident is moving from a home that's operated by the same licensee, it tends to move faster and more streamlined. This change to the rules, it will extend that efficiency to homes that are operated by related licensees, and it's always subject to certain conditions. Now, on the next slide, as we move forward, the ministry is certainly going to work to continue to keep family members, caregivers, residents updated on changes and considerations about the regulation and the legislation. We always are looking to consult with key partners. So when we get on to our last slide, we're going to have a contact email there that people can reach out to us if there's information that you'd like to share with us. And maybe we will move to that next slide because this is where you'll see our contact information. It has really been fantastic to connect today. I want to thank you for your time. And I think we've got some time now for questions. So I think maybe we've got a question from Eleanor.
First of all, I would like to thank you, all those in the ministry, for this session today, and the FCO for providing it. We need more of that. As you may not know, I'm involved with the Champlain Family Council Network, and we assist and support starting up and supporting family councils. And there's continuously questions that we get asked. And it's great to have this session because sometimes I'm flying on my wings or bum, if you want to be, because I'm not quite sure. But can this presentation be provided that I can print it out and have it more readily? Secondly, the air conditioning is key to so much. Many new homes now are renovated. Yes, would have a system installed, but there are some older homes, especially in the rural areas, that do not have, and it's very difficult to have air conditioning, portables and otherwise, for many reasons, including the many hydro outage in the area. So, but my key point is thank you, and more of these. Thanks.
Eleanor, thanks so much for those comments. We're happy to make time all the time. Now, I think we've still got Sean on the line, and it looks like we've got a couple of questions that are related to air conditioning. So, Sean, are you there?
Yes, I'm here, Lori. Thanks. Yeah, so I see there's a few questions here from Bill. I might jump around a bit here because I see there's a few. So I'll jump to maybe the second one here. What can be done when the room is above 26 degrees outside of May 15th and to May 7th, or May 15th to May or September 15th? So those are the dates when, if a home has portable units, they need to be installed then if the residents agree to it. If there's days just before that, let's say it's May 14th, the home, like homes, they don't have to wait until those days to have them installed. It'd be the expectation that the air conditioning would be turned on if the home is looking ahead and seeing May 14th, it's going to be a super hot day. The expectation is the air conditioning is turned on and the portable units are in place. They need to continue to maintain that degrees in between a minimum of 22 degrees and as high as 26 degrees. And when it falls above that 26 degrees, I believe Lori mentioned the heat-related illness prevention and management plan would need to be in place across the home. And in that, there's a number of measures that homes could take. So I'm just thinking of for instance, they could be developing enhanced hydration protocols. They could be providing alternate menus to replace hot entrees to support reduced use of heat. There's a number of different initiatives that the home would be undertaking there.
So sorry if I just could. So it's my question that I post. It's not when it's getting close to this. I'm talking in January and in December when my mom first moved in. Her room was in excess of 30 degrees because they were having heat-related issues that they've still not resolved. And it's only now that the heating season has been turned off and her wall pack air conditioner has had an error 7 since the day she moved in December 13th that they still have yet to repair. And now they have it unplugged. And her room was 26.5 2 weeks ago when I was in there. And before that, we used an analog thermometer, not a digital one. So it was difficult when we would go in to record those. So now, thank you for sharing the part about the Long-Term Care Act. And I've looked at subsection 24, where the licensee shall keep a record of the measurements documented under subsections 2, 3, and 4 for at least 1 year. My question is, who has access to those records then that show my mom's room was in excess of that temperature for a long period of time?
Yes, the home should have those records.
But can we access them as family, or who has a right to see those to say, why was nothing done when her room was at this temperature?
I would need to, apologies, I would need to circle back to confirm who would be able to access those records.
Okay.
If you could, apologies for this, but if you could contact the email that's on the screen, that question can be directed to me and we can follow up with you to confirm that.
Sorry,
I'm sorry to interrupt, but can I ask a question? Are those supposed to be documented in the residence care plan specifically because it's to do with that residence room?
I think it's a great question. I don't believe that it would be the care plan, but Bill, if it's all right with you, can we take that question away? I mean, I would encourage anybody who has questions that are specific about their loved one in long-term care to send an email to that ministry contact that you see. But Bill, we've noted your question. We'll take that away and get some answers for you because regretfully, I don't know the answer either myself, but we'll endeavor to get that response to you. I'm very mindful of the time, and I think maybe we've got time for one more question, and I think Joanne has her hand up, although maybe that was connected.
No, it's not connected. I do have
Oh,
my
okay.
hand up.
All right,
So-
Joanne, so last question over to you.
I just want to confirm that these slides are going to be shared, first of all, and second of all, when back when the Fixed Long-Term Care Act was being formulated, there were copious amounts of resident and family engagement sessions held to garner input from families and residents and whatnot. And now that it's been in place for a couple of years and these sorts of things are coming up, you know, would you, the ministry consider perhaps having Family Council and the Residents Council Association host some more sessions to get input from the parts of the Fixed Long-Term Care Act that are either cumbersome or not working or are impacting families and residents, like just to have like a review of, okay, this is what we put in place based on all our conversations, and so let's talk about what's working and what's not working.
Yeah, Joanne, let us take that away, because I mean, one thing we are trying to do increasingly as a ministry is exactly what you're proposing: be more engaged directly with residents, families, caregivers. One thing that, and you may be aware of this already, but just to share this information for everybody who's joined today, when the ministry is thinking about making changes to either the legislation or the regulation that sort of sets those rules for long-term care homes, there is a website, Ontario's Regulatory Registry, where the idea is published and we're seeking public input. And as someone who works in this space regularly, I can tell you that we often get input from like organizations like Family Councils Ontario, like Ontario Association of Residents Councils, but we also get like emails and submissions from members of the public. So you can always send comments in on an idea that the ministry is thinking about. So
But
just wanted to make sure you were aware of that.
So that's an idea that you guys have had that you're looking for input on. What I'm suggesting is that if we had these open forums, that perhaps family members and residents have suggestions that haven't been thought about from the ministry's perspective or from the home's perspective, because I know that the homes give a lot of these changes to the requirements around staffing and stuff are not based on family members saying that we don't want them to have qualifications. It's based on the home saying this has made our job really cumbersome and difficult to find staff, and it's made it difficult to work around. So a lot of it's coming from recommendations from the home. But what you're saying is great, that there's an option there when you guys come up with an idea. What I'm suggesting is an open forum where family members and residents can propose ideas.
Well, I think it's a great suggestion, Joanne. Let me take that back, we work really closely we've got a great relationship with Family Councils Ontario and Ontario Association of Residents Councils. So let us explore that a bit further with them. I think it's a great suggestion.
Okay, perfect.
So
yeah, and I mean, FCO and OWARC is the perfect conduit to do that, right? So yeah, okay, perfect. Thank you for today's session. Very informative.
All right. Well, we've gone a little bit over time. I know everyone's time is precious. I do want to thank you all for joining. It's been enormously helpful for us to hear the voices directly of families and caregivers. It's extremely meaningful to us. You've got contact information here to get in touch with us. If you have any follow-up questions, we're more than happy to respond. And with that, Tiffany, I don't know if you had any closing remarks or if you'd like me to close it out here, but my best wishes to everybody. Thank you for joining.
Perfect. Thanks so much, Lori. Lots of great information, questions, and dialogue. And we definitely want to encourage our service users to connect with FCO, share your insights, experiences, observations, so that we can continue to share sound recommendations with Lori and other partners at the ministry. So special thanks to the Ministry of Long-Term Care and all of their team members that attended and presented today. We really appreciate your time and efforts and everything put into this work being done to support long-term care homes across the province, and especially as the season changes. I also want to take this time to recognize FCO's bilingual events and project specialist, Tae Young, who has led the coordination and tech support of all of these ministry webinars. Thank you to all of the session attendees as well for joining us. And just a reminder, the webinar has been recorded and it will be posted on our YouTube channel and website in the coming days. So please stay tuned to our e-bulletin for that link. We strongly encourage you as well to share this information with your networks and your peers. And as well, please do reach out to the ministry at the email address provided for any additional questions or comments. Thank you so much to everyone for being here. Take care, stay safe, and have an amazing day.